when it comes down to this, you have living organisms that are growing inside of a home, whether it's bacteria, whether it's mold, and they're constantly producing particles. They also have the capability of producing toxins. We don't really know why. We know it's a self-defense mechanism, but we don't know how. I've seen papers on, Wi-Fi activity might make mold feel threatened and produce mycotoxins. Maybe spraying bleach and other chemicals that might make mold feel threatened. So we don't know the exact why. We have some theories, but in any case, we can measure them, right? So it's always looking at measuring them and understanding if they're there or not there, as well as they produce spores, right? Bacteria produces spores, mold produces spores. It's kind of like the seed of a plant, if you will, right? It's how it reproduces. But mold's very small, and it colonizes together. Same thing like bacteria. And because it's so small, just taking one breath, you can inhale a lot of it at once. As a matter of fact, it's like 250,000 spores would fit on the head of a pin, just to give people some relative size perspective. And so, when you go outside, every breath you take, you might be breathing in about 1,000 mold spores. And that's with an almost infinite volume of air, right? Inside your home, it could be much worse. You could be breathing in 100,000, 1,000,000, a couple million with each breath you take. And so there is this relativity. The phrase "too much of anything will kill you" it never really held more value than here, because it's the more that you're breathing in, the more that your body has to fight to remove.
Right. All great points. And that kind of brings me to another question then, and that is the testing of a home to determine whether you have a mold problem, whether there's colonization, whether there's mycotoxins, whether there's something you even need to deal with. Because, you and I were involved with Ash Brockington and her husband in that home. And I mean, they buy this home, their dream home, and all the building inspections that have been done were like perfect, great house, great condition. And 2 years into the home, and the entire family is poisoned with mold exposure and leading to so many health issues. Come to find out that the walls are just riddled with mold. And so it was nothing that was seen. It was nothing that they smelled. And even the experts, so-called building inspectors, experts looking around, didn't see any sign whatsoever. Then you get situations where somebody does an ERMI test, gets super high results, zero mold to be found in inspection. And so I guess I'm interested in learning about, your methods, what tests you rely on, whether it's an ERMI test or Hertzsprung test or, dust test and so forth.
Sure.
And, how come some testing shows mold, but they can't find any? Some testing shows no mold, but they're riddled with it.
Yeah, I mean, it's testing is probably the bane of any scientific community's existence, and it's because different tests have different applications where they might be utilized better for something. To give you an example, we're talking about the dust test, ERMI, Hertzsprung. They're all many different names. They're all based around the same technology. And essentially, what they do is they utilize PCR technology. They look at the DNA of what's there, and they measure your dust, and they're basically identifying what's in the dust. That is a great screening tool, meaning you want to answer the question, do I have mold? Do I have bacteria? Do I have toxins? That's a great answer, because if it's in your dust, it's being created somewhere getting into your dust, right? And so that helps with that. Where it's horrible for is telling you where the mold is, right? And so then we go to air testing. Air testing is fantastic if you're testing very close to where you suspect the problem may be. If I test in my living room, and I'm in a hotel right now, by the way, at an event, but if let's say I test right behind me here, which would be this living room, to identify a problem in the backhand corner of the kitchen, well, it's pretty far away.
Yeah.
And you're not going to really get a great representation of the kitchen. We all learned through COVID that there's like this 6 foot rule, which sometimes 6 feet's even too far. I've seen studies where people took air tests like 1 foot away, 2 foot away, 3 foot away, and 4 foot away from a known problem. Like they identified the problem first, and then they took different air tests of different measurements. And there's no secret. The further away that you got, the less likely you were to think that there was a problem there. And in fact, once you hit about 4 feet away, it looked like less than outside. And so from an air test perspective, which all is microscopy and it's comparative analysis, meaning all you do is compare one sample to an outside baseline sample to make any sort of judgment call as to whether there is or isn't a problem. And I think it's really good as long as you're testing on top of the issue to see, what sort of issue you're dealing with. You can miss a lot of things. I think with air testing, it was the staple of how we identified homes for so long, because it was such an easy, convenient technology. You had this little pump, you loaded up in your trunk, you had little cassettes, you snapped on place. And, you could do a whole house taking 3 or 4 samples in less than an hour. You were in and out. You got your samples. You sent them back. And 9 times out of 10, you were telling people, looks great. Yeah, everything's fine here. The problem is that you would have to do, let's just say you have 1,000 square foot home. You would have to do a lot of different air samples all across the house, right? Almost as if you were digital printing the home and you wanted to kind of get every little vector of the airspace to really be able to tell someone comfortably that there is nothing wrong with your house utilizing that technology, because it's not a very useful screening tool. And unfortunately, it's been used as a screening tool for a really long time. Matter of fact, somewhere right now in this country, someone is taking 3 air samples of a home right now as a representation of if they do not have a problem.
Right.
And I think, coming back to, we talked a little bit about insurance, talked a little about remediation. This is one area that is very easy to change. It's very easy to move forward. It's going back. There's a lot of amazing technologies today. Look at a home. You have thermal imaging. You have moisture readings that you could take. You have air samples where you're just testing closer to the issue. You have the swab surface samples. You have dust testing you can do. I mean, I think it's about looking at all of this. The other thing that I would say about testing that I don't often see, especially if I just get a random report from a client, from someone I've never worked with before, I never see testing of the HVAC system and the coil and all of that. Sometimes we'll do like an air sample again in the center of the room and say, well, no, the HVAC is good because I did an air sample in the center of the room, and if the HVAC was bad, I would have picked it up. And it's like, well, not if you're 40 feet away from the coil, right? I mean, it's really interesting because the evaporator coil constantly condensates. I mean, it is a wet environment, which what is mold and bacteria like? Viruses, wet environments. So it's perfect. It's a perfect environment for these things to grow. None of us really ever have good filtration unless we specifically know. I just worked with a client who had a 12-inch gap between the filter and the actual hole that the filter goes in. So basically, they bought a more expensive filter, but had like a 2-inch pleated media filter before, and then went to like like a 1-inch one or. And anyways, it was, I mean, the filter was going like this inside the cabinet as the air was blowing. So this amazing expensive filter they bought, because it wasn't installed properly, just wasn't even working.
Doing nothing.
Right?
Yeah.
And you see so many of these stories all the time of people, trying to educate themselves, trying to make good decisions, get the best filtration they can get. But you have, that whole HVAC industry isn't really on board with the technology. And then you have, a lot of hygienists that aren't thinking about the HVAC and how the HVAC might play a part in the quality of air that they're breathing. And so it's a lot to digest, I know, but I'm spitballing all the different things that come to mind, because I think it's really important as we develop a community of how do we help more people live healthier lives. This is all stuff we need to be thinking about.